Welcome back. Well, this story is hot right now. Plastic surgery is on the rise. The American Society of Plastic Surgeons just released some new information. Listen to this statistic. They're saying there is a 100% increase in rear end augmentation over the past year. 100% increase. Many telling their doctors it's because they want to look like certain celebrities who have a little bit of extra back. Ones like Kim Kardashian or J-Lo. Of course, we're showing all those super skinny celebrities in our video there. There we go. There's somebody who's got a little curve to her. Joining us this morning to talk more about it is Dr. Armando Soto. He's a board-certified plastic surgeon at Aesthetic Enhancements. Great to see you, as always.
Nice to see you, too.
So you're seeing this in your practice as well?
Absolutely. Yeah, we do quite a bit of this surgery, actually.
Okay, so talk to me a little bit about what this surgery entails. It sounds painful.
You know, for most women, it's actually a fairly simple procedure, although it is surgery, and it's important to realize that. As I say, for the majority of patients who are interested in a little enhancement on their backside, we just do a little liposuction and then graft it into the buttocks.
Oh, wow.
So
okay.
the fat cells will survive there to a large extent and improve the fullness and shape of the bottom.
Now, is this something that eventually it'll wear down and you'd have to redo it? Yeah,
some of the fat cells do get reabsorbed because you're not transplanting a blood supply. So, you know, we usually tell people somewhere between 50%, 30 to 50% is going to be reabsorbed. So don't expect it to stay as big as it is right after surgery.
Now, how much would something like that cost you on average?
It depends on how much we're doing. So in my practice, personally, our fees are based on how much time the procedure is going to take. But, you know, it'll be at least a few $1,000s for sure because it is surgery.
Now, what about the implant, the actual implant? Is that something you're seeing more of too? And what's the difference there between the two options?
Oh, there's a huge difference. The buttock implants are not to be thought of similar to breast implants. They're not as well tolerated. They get infected more often. They don't look nearly as natural. They need to be replaced much more often. So it's not, you know, what I tell patients in my practice, that buttock implants generally aren't going to be well tolerated or well received. They're not going to make you happy unless you're like Nicki Minaj and you're making money performing and showing your bottom, you know.
Why is that? Why is it the implant just doesn't do well in that area?
You know, they're funny to sit on. They don't look right. The shape is a little bit, you know, unnatural in most women. And as I say, they get infected a lot. They need to be replaced a lot. So it's that particular detail of the treatment is not really that great.
I got you. That makes sense. Okay, so what kind of candidates would be good for this? I mean, we're talking about, and we all know somebody who's got kind of that flat derriere, right?
Right. Yeah. And so, you know, a lot of women just want a little more curve. You know, so we remove fat from parts of their body where they're not so happy to have it, and we put it into their bottom, and so they benefit in both areas, and they get a more feminine silhouette. But the key is, you know, finding somebody who knows what they're doing and who, you know, is going to make smart decisions for you, and making sure your goals are realistic. Yeah.
Absolutely. That's the most important thing. If our viewers would like to reach out to you, how do they find you?
www.drarmandosoto.com.
All right. Always a pleasure, Dr. Soto.
Nice to see you too.
Interesting stuff, isn't it? All right, Jamie, you're not thinking about doing this, are you? I'm just
Not a chance. Not a chance. Let's talk about